Today, we're excited to speak with Dr. Mara Bargeron, an educational psychologist turned root cause medicine practitioner. Dr. Mara specializes in prevention of chronic illness and neurodevelopmental disorders with preconception nutrition, as well as healing neurodevelopmental disorders and other chronic illnesses and stealth infections such as Lyme, mold, and heavy metal toxicity. How important is it to focus on healing mom's health issues before conception? What does a root cause approach actually look like? What can be done about chronic issues like toxicity? All of these questions matter tremendously to us here at The Brain Possible, and we are excited to learn all that and more from Dr. Mara today. Thank you so much for joining us today on the Brain Possible podcast. I was reading through some of your posts again last night in preparation for this, and I'm really excited that you could join us.
Yeah, me too.
So first, I always like to start, can you talk a little bit about what drew you to this more holistic side of the medical spectrum? I read about it a few times on your page, and I would love to share with everyone from your perspective.
Yeah, so I used to be a neuropsychologist. That's like my first career. So I used to work in the schools, and I evaluated kids for neurodevelopmental disorders, so autism, ADHD, specific learning disability, Down syndrome, things like that, to qualify them for special education services. Mm-hmm. And when I first started in the field, there was a lot of teachers who were like more or less baby boomers, and they had retired and they came back, and a lot of them would tell me, they would ask me like, what's happening like with our kids nowadays, and they would tell me like how things were in the 70s even, or the 80s or the early 90s. They said things started to kind of change toward the late 90s, and definitely in the 2000s they started seeing just a huge jump in behavioral disorders, ADHD, just autism, just so like our special education rates are skyrocketing. Like there's just not enough people in the field actually for, that have my position. There's not enough speech and language pathologists. There's not enough occupational therapists because our caseloads just keep skyrocketing every year. Wow. So I started to kind of want to take a deeper look into all of that, because as millennials, as a millennial, I don't remember too much, but I don't remember having, nowadays we have, peanut-free, nut-free classrooms and things like that. I never experienced that as a child. I remember special education was pretty small. There weren't a large number of kids in schools that receive special education services, but now, kids are very used to seeing a lot of kids that have, a number of disabilities. So I started to get very curious. Mm-hmm. And then I met my husband, who, his nephew had a very severe reaction. I think it was his 12 or 18 month shots, and he had a seizure. And he regressed developmentally like right away. So I started just kind of investigating.
Yeah.
And I was already like really into health and wellness. So I had just, based on my research, I just decided to go back to school. I got, I already had a PhD in neuropsychology, but I went back and got an MS in human nutrition and functional medicine, and took lots of different programs since then, and just started. At first, I only worked with kids with neurodevelopmental disorders, but now I've kind of branched out, and I work with adults now, and I work with, I really specialize in mold toxicity, Lyme and Lyme co-infections, heavy metal toxicity, just toxicity in general, which has really just skyrocketed nowadays. And I'm also really passionate because there's so many risk factors to having children with chronic illness. and neurodevelopmental disorders. So I'm really passionate about working with moms in the preconception stage, or the trimester, we call it, because there's so much you can do to control that, but moms are not educated in that. It's not something that is known in society, fortunately. So I'm trying to reach more of those moms, but most of the moms I do work with, I worked with their first child who had a chronic illness or a neurodevelopmental disorder. I worked with their child first, and they started learning by working with me, because a lot of these moms, you know, they have autoimmune conditions, they have mold toxicity, they have a lot of health issues, and they want to do things very differently this time. We work on healing their health issues and making sure they're in the best, you know, optimal stage to or state to, you know, have the healthiest fetus possible. May conceive again. So that's usually how I end up working with moms in that trimester phase.
Yeah. I have learned a little bit about that as well after all of my pregnancies. But I spoke with Dr. Michelle Perro, who's also passionate about that, and she calls that preparing the terrain, I think. Yeah. Which is essentially like, you know, this soil that you're going to grow this baby in, and nourish the baby from, making sure that that is, you know, optimal. Yeah.
But we're not educated on that. So unfortunately, sometimes moms hear about it after they've had, you know, kids already, like in your case. So it's really hard to find those moms before they leave.
It is. And also I think sometimes people just generally, maybe this is the case, not with everyone, but generally it seems like people aren't as concerned about things until, you know, they know someone who something's happened to, or if something happened to themselves or their children. And then all of a sudden they become concerned.
Prevention in general is not really highly emphasized in our society. Like, we don't prevent really anything. Like, when you look at lots of sectors of society, I mean, there's no prevention happening ever. It's really all very reactionary.
Yeah, it's sad. Okay, so let's talk a little bit more about, so you call yourself an educational psychologist turned root cause practitioner. What does that mean for your patients, and how do you seek out root cause?
So it's really bio-individual. You know, I have a lot of people, you know, through Instagram and such that ask me, hey, I think just yesterday someone asked me, hey, do you have any you know, a protocol or suggestions for like ALS? You know, people will ask me, what can I do for, you know, my Graves' disease? And I'm like, well, it's very bio-individual. There's really I've never even, you know, among children with autism, among children with ADHD, among people that have, you know, colitis, ulcerative colitis, I've never given the same protocol. So root cause medicine is really finding the underlying cause, or the root cause as to why you have a thing. Like, you know, one of the common, you know, a lot of kids I work with are iron deficient. You know, conventional medicine approach, and even a functional medicine approach, how a lot of functional medicine practitioners practice, they practice more like green pharmacy than they do root cause medicine. That's why I've kind of distinguished myself from functional medicine, because I've become like less and less impressed by how a lot of practitioners practice. There's some amazing functional med practitioners, but there's like a new subsect of practitioners that really medicine, just like giving you a supplement to correct an issue. So like with iron, a common prescription, you know, they're just going to tell you, hey, just take an iron supplement. But actually there's a lot of different reasons as to why you could have an iron deficiency. There's parasites. Parasites eat your ferritin. Heavy metal toxicity is correlated with iron deficiency. You can have significant hormone or thyroid imbalances that cause significant menstrual bleeding. Like, you can have internal bleeding. There's a lot of different reasons. H. pylori can cause an iron deficiency. So it's figuring out what the root cause is and healing that, so that you're not just throwing supplements at someone that they have to take forever. So that's what they kind of call green pharmacy, where, in conventional medicine, they prescribe you a pharmaceutical, but in green pharmacy, they prescribe you a supplement.
Right.
That really doesn't address the root cause. And sometimes, you will have to take supplements for a period of time. But, things like that, where you're not looking at the root cause and looking at healing that underlying root cause, that supplement becomes kind of like a lifetime thing that you're going to have to take.
I hear that. I've never worked with anyone. I think everyone is, each practitioner is so unique. Well, I take that back, but I've worked with all different kinds of practitioners. The ones that I've been working with the most do testing pretty frequently to see, okay, well, we've been taking these things for a while now. Now we need to see, where you're at, and if you need to be continuing changing them or, discontinuing them because you're balanced now. Which I think makes a lot more sense. It's just so much more time consuming and more expensive.
Yeah. And there is, a lot of times if you are a skilled practitioner, you can figure things out just by signs and symptoms and things like that. I think there is, in general, just a lot of over testing that happens in functional medicine.
Really?
I've worked with some parents who've seen, functional med physicians in person, and they all have very, very similar protocols. Even, they've seen completely different doctors. They, totally different states. Their protocols are very, very similar. And they often went in having to spend like $1,200 or $1,500 on testing. So, all of that testing's not always necessary.
Yeah. Do you use testing?
I do. Honestly, if you give a full panel of blood work, which hardly anyone does, and you know how to interpret that from a functional perspective, and look at optimal ranges versus standard lab reference ranges, you can actually determine a lot. It's just a lot of practitioners don't know how to read and interpret blood work very well. So I can tell a lot just by blood work alone. And then if I do need to give additional tests, I do give, different lab tests, different functional labs, like the GI map, stool analysis, the Dutch test, things like that. But they're not always necessary for everyone.
Do you use the hair and mineral analysis?
I do. Yeah.
Yeah.
I don't like to give that right away. I think it's a little more accurate when you give it a few months in. But I do love that test for looking at mineral balance as well as like heavy metal toxicity.
Oh, okay. Yeah. Yeah. That's one thing that the woman I've been working with has done with me, and no one else had done that or suggested it. And it's made a huge difference because just by the minerals that she was able to put me on, I was able to taper off of antidepressants that I'd been on since I was 15.
That's great. Yeah. A lot of these tests, just, you have to be trained really appropriately in interpreting them. Because just because you have the credentials to run a certain lab test, doesn't mean that you know how to interpret it.
I know.
So that's, a lot of people, they come to me and they say, the practitioner I was working with before, I paid for this stool analysis or this, hair tissue mineral analysis, and I don't feel like they really, was able to explain it very well to me. And I'm like, well, not every practitioner received training. I mean, just for the HTMA, I took like a 30-hour course and just interpreting that. So, that's not a required thing amongst practitioners. So it's something, you have to be careful of.
Wow. Yeah, I know. It does seem really complicated. And I have a sister who is learning how to do it right now too, but she's a functional medicine health coach, and she, is still hesitant to and not ready to read those or try and interpret those testing, the hair and mineral analysis, because they are complicated, I guess.
Yeah. You want to have some experience and definitely be adequately trained before, you have patients spend, their own money on these tests. But Yeah, unfortunately, some people ask me, well, what test should I ask my provider for? I'm like, well, I can't really tell you that because
Yeah.
practitioners all differ. We don't have the same training. If I tell you this is the best test, for, GI map is the best stool analysis, that provider is not necessarily trained in that. Again, I took like a 40-hour course or more on just the GI map. And so a lot of practitioners are not trained on it. So I can't.
Do
can't
people do people ask you this on Instagram or social
yeah,
media?
a lot. They
Yeah.
ask me, which test can I ask my, my
Right.
children's doctor for, or my doctor for? And I'm like, I can't, if they're a skilled practitioner, they should be able to give you the recommendations on which test or functional lab
Yeah.
would work is most appropriate for you.
Yeah, I hear that a lot, that there's people, following wonderful accounts, but then they just want the free advice, which you can't really give because that's not bio individual to
Right.
just,
That's
yeah.
very, very common, asking for medical advice. And I think people don't understand the legal aspect of that. And they also don't understand that I don't know anything about you. So
Yeah. Yeah.
I can't give you, it's not really ethical for me to give you advice via
Yeah.
Instagram.
Well, let's focus on preconception for a moment and go back to that. So, how important is mom's health in this phase of preconception? And is there a right time health wise to get pregnant for optimal infant health? Or in other words, also, when do you recommend that moms start cleaning up and preparing? How far in advance before they get pregnant do you recommend that they are?
Yeah, it depends on what type of health issues mom has. For me, 6 months in advance was plenty of time for me. I didn't have, any health issues, things like that. I was just trying to clean things up, making sure I was in optimal ranges of everything. All my blood work was great. My micronutrients were great. But I don't have any, diagnosable health issues. I don't have, thyroid issues, autoimmunity. For people who have things like that, or Lyme disease, mold toxicity, those things take longer. So ideally, I would love to work with moms a year in advance if they do have those types of more serious health issues.
Mm-hmm.
That would really be optimal. 3 to 6 months, I would say, is the minimum.
Right. And how do people know if they have mold toxicity? So I know you can present with a number of symptoms, right? But they could be multiple things. And it's just an area I don't know a ton about, but I hear a lot about.
Yeah, a lot of, symptoms, but, those can overlap with other things as well. So, but most of the people I work with, they know for sure, like they were in a moldy house,
right,
where they had water damage, or, the basement smelled very, musty, or they worked in a building that was very, very musty. Like people usually know when they are in an environment that's moldy, they can kind of smell it. Or they know they've had water damage or things like that. So most people that come to me, they know that there was a mold issue, but they haven't dealt with it. So even if you leave the environment, which is optimal, that mold is still, it's still in there. It's still in your body. A lot of people I see struggle with a lot of issues of the brain. So a lot of sinus issues, respiratory issues, a lot of anxiety, brain fog, things like that. So it really differs per person, but usually people know when they were in a moldy environment.
Is there testing that can show you like, oh, wow, you have, I don't know, I'm not functional or a practitioner.
Yeah.
Is there testing that can show like, oh, I see all the mold?
Yeah. I have signs and symptoms forms that kind of alert me to that, if people are not aware. And if they have a lot of those signs and symptoms, it's kind of an alert. Sometimes through the OAT, the organic acids, if they're high in those like yeast and fungi, it'll be kind of a tip off. But Great Plains Laboratory and also Vibrant America, I think it's Vibrant Labs or Vibrant America, they both have mycotoxin panels. So that would be like a test I would give if people are not sure that they were in a moldy environment. If they are sure that they were in a moldy environment, I'm not as quick to recommend a mycotoxin test because usually they have the signs and symptoms as well. So, it's one of those things that it's not necessary to test. But if, people have no idea, but they do have some signs and symptoms, then I can run a mycotoxin test to look at if they do have mold in the body.
Well, so what are some of the, complications or things that can happen to baby if mama doesn't clean up?
Well, those things they're just like passed down. So Lyme and mold, if mom has poor gut health, has like a poor vaginal microbiota, and baby passes through, all of that is going to be, passed down. I think there was one research study, what you may be familiar with, but when they looked at umbilical cords of newborn babies and found like newborn babies were having like, 200, I think it's like 237 different carcinogens or toxins or heavy metals just in the umbilical cord, before a baby's even born, they already are exposed to that amount of toxic burden. So that's something that can definitely be significantly reduced if, if we dealt with detoxification and things like that before mom conceived. And really like making sure the microbiome is really, really great for mom is really going to have a lot of impact because the microbiome is really responsible for so many things, and immune health and gut health and the microbiome all kind of go together and depend on each other.
And whatever mom's microbiome looked like is what baby's is going to look like, right?
Yeah. When baby passes through the vaginal canal, that's kind of how their microbiome is inoculated. So they really depend on that. So that's one of the negative things about, a C-section, other than that it's like a major surgery. Moms don't receive informed consent on C-sections, and our C-section rates are way too high in this country. They're about 34%. Several years ago, I remember looking at it and it was 28%. Now it's 34%. So it's just increasing by the year. And some cities have rates as high as 40%. So, and there have been research studies. There was one in Sweden in 2015, and they found that children delivered via C-section had significantly increased risk of asthma, connective tissue disorders, juvenile arthritis, inflammatory bowel disease, immune deficiency, and leukemia. And there was also a 2020 study. It was a meta-analysis, which is like the highest powered research. And they found that children delivered via C-section are more commonly develop respiratory tract infections, obesity, and asthma than kids who were born vaginally. So it makes a big difference.
Right. But it's also can be life-saving for the percentage of people that actually need it, which is not as high as 30 and 40%.
Very, very small percent. Ina Mae Gaskin, who you may have heard of, she's like the OG midwife. She estimated in her book, Guide to Childbirth, that less than 4% of moms are truly at risk and require intervention. So that's such a small number of moms. That really would require that.
Right.
But once you have an OBGYN, you deliver in the hospital, it's very hard to avoid that cascade of interventions that causes C-section. And some moms even elect C-section.
Oh, yeah. I hear that.
That's another problem. That's why that rate is higher, is we have moms that are electing that because their OBGYNs are not giving informed consent. Their OBGYNs probably don't even know the research on this to give them informed consent, even if they knew it. So that's a big problem.
Is there anything that can be done if someone has to have a C-section?
There's vaginal seeding. That's a new thing. But again, anytime you go against something that is like normal standard practice in the hospital, it's difficult.
Right. They think like,
So they will probably think you're insane. I'm not sure if they will, support it or not. Some hospitals may, some may not. Just kind of depends.
right.
My best advice when I work with moms, I usually guide them if they are low risk, which most of them are, to look at a midwife. And if they are in that very small percentage of moms who would be at risk and they would need to deliver in a hospital. I think my midwife, she's been a midwife for as long as I've been alive. And she said like her rate of having a transfer for a C-section is like 1%. It's so small. Mm-hmm. She's been a midwife over 30 years. So it's very small. So one of the first things mom can do to lessen that is, one, to be in optimal health before she conceives, and two, to seek a midwife if possible, if she is in that small percentage, if she's in the majority, percent right. Moms who are not at risk.
Mm-hmm. What, if any, potential damage can be undone post-conception? So say someone, like we talked about, most people don't know about, cleaning up the terrain prior to conception. And then they find out after, there's something wrong with baby or their child. What can be undone? Which is what your job is about, right?
Yeah, you can help the microbiome. They estimate 60 to 70% of a child's microbiome is determined by the age of 3. So that's fortunately or unfortunately, but that microbiome tends to stick with them for life by age 3. So 60 to 70% of that microbiome. So we do have room to increase that. But even when you take antibiotics, some of those bacteria, because it kills all the healthy and the opportunistic, whatever it is that it's killing, it just kind of wipes the terrain. A lot of those microbes never come back.
Wow. Even if you take, the supplements or add in the ones that are missing.
Yeah. That's a huge misconception that, you can just take a probiotic and, you can replace all of the, the microbes that were lost. You can increase some of them. Especially, if you take prebiotics, which are usually like vegetable fibers and things like that. Anything with fiber is really going to feed the healthy bacteria to help them proliferate and grow. But there are some that, you're not going to be able to increase. I've done a lot of work myself. I didn't have the optimal best, childhood. I was born vaginally, thank goodness, but I was not breastfed. So that's going to affect a child's microbiome as well. So I had to do a lot of work. When I was a kid, I got sick all the time.
Me too.
All the time. Always sick. Microbiome was not great. My immune system wasn't great. I was fed, junk food, formula. So, that it was pretty evident during childhood. I had chronic ear infections, sick all the time. So I did, make a big change. We are resilient. So when I was 24, I did make a complete lifestyle change. Before that, in college and grad school, I was raised on Pop-Tarts and, Olive Garden and food like that. So I did make a huge change, and, I'm significantly healthier now. I rarely ever get sick. So you can improve things. It's just a lot easier, to prevent them from happening in the first place, obviously, but you can improve it. It does take a while.
Mm-hmm. Okay. So mainly after, if there's any damage or something, developmental delay with a child, you just start with the microbiome.
Yeah, it kind of depends on the child. Kids with autism, they have a lot of different root causes. A lot of times they have complex picky eating. So that's going to be something that we have to address early on in order to make progress. But, gut health and foundations first. There's an order of operations of things. But I always foundations first, and then with kids. I think most kids and adults I work with now have parasites. So those are things we have to address first before we can move on to other things. That's a big misconception about, you can detox first. A lot of parents are very anxious to detox
Yes.
But detoxification of heavy metals happens way later. You're not ready to deal with that first. You have to work on gut health and making sure your drainage pathways are open, making sure you're, pooping twice a day at least. That's really setting yourself up to detoxify, bigger things like heavy metals down the line, but it's not something that's addressed first.
Right. Parasites are common, right? I've been learning a little bit about these in my household. And so can you talk a little bit about parasites? I didn't realize how common they are. What kinds of problems can they cause?
Yeah, there's a big misconception that, it happens in like developing countries or third world countries. Dr. Jay Davidson, I think he's the CEO of Cellcore Biosciences. He talks about, he says, if you have a pulse, you have a parasite. I mean, they're just so common. I think everyone I've worked with so far has have issues with parasites. Some have pretty glaring issues. Like butt itching is like a glaring issue,
teeth
grinding, things like that are pretty
itching
obvious signs.
Itching is pinworms. Could mean pinworms.
Could mean, yeah. It could
or others.
It could be others. So there's, a couple kids I work with who, their moms see like them scratching their butt. That's a pretty obvious sign of parasites, but I find most people don't have obvious signs. I didn't have any signs of parasites, and I did pass many parasites. So it can cause a lot of issues. Parasites can also harbor things like heavy metals and Lyme. So that's why you want to address those first, to get rid of that. And it can cause things like, if you have a dairy sensitivity, likely you have parasites. So it's just something that we deal with first.
Wow. And what, when I first heard, parasites, I was like shocked, but there's many different kinds. Can you go through a little bit, some of the more common ones you see?
Really, there's just so many different ones that I see with people. I don't generally there's certain tests that can tell you exactly or you can compare. You could people like to pick out parasites when they see them and kind of you probably you've seen on social media pictures of parasite pictures.
It's so gross.
Yeah, it's pretty common. Even my clients, they send me pictures of parasites, but there's certain, through muscle testing and bioresonance scans, I do both of those. I can kind of tell which type of parasite, but that's not as important as just removing the parasites.
Right. Is that difficult to remove them?
No, you just have to, address foundations first. Usually we have 2 to 3 rounds of parasites before we move on to other things, while we're also healing the other gut issues, because usually people have other gut issues other than just parasites. But usually 2 to 3 rounds, usually 2 rounds for the average person, but some people who have more pervasive issues, they might need 3 rounds. And it's important that you switch out products. You're not using the same parasite products for each round. That's okay. Effective. So I use a combination of Cellcore Biosciences, and Byron White, and Supreme Nutrition. Those are usually the three different ones I vacillate through. They have different parasite products. So it's kind of very bio-individual, though, which ones I will use.
Yeah. So let's shift gears and talk about conditions like heavy metal toxicity. How do you identify that with your patients? You said everyone's usually, and that is a hot topic, especially around, in the autism community. People might be anxious to detox. How do you find out that they have heavy metals?
We can determine that. Well, signs and symptoms is one. Signs and symptoms forms are really important when we do the initial intake. It's a really deep dive. if like me, I actually had an obvious sign of heavy metal for mercury, because I had my, when I first learned years ago in my mid-20s, when I first learned that, the silver amalgam fillings were actually mercury.
Right.
I was very anxious to have them removed because I'm very into health and wellness. This was before I changed careers, but I was just very into health and wellness. And I went to a conventional dentist to have them removed, and he didn't use the SAFE protocol or the SMART protocol. I forgot what it's called, the SAFE or the SMART protocol, where biological dentists use a very specific protocol to safely remove the silver amalgam fillings in the mouth. My conventional dentist, I didn't know about it, and
Right.
conventional dentists don't do that. So I was likely exposed to significant mercury just, just by that one dental
Right.
visit. So, some kids have things like that. But I can do things like muscle testing, bioresonance scans. There's also heavy, the HTMA, the hair tissue mineral analysis. Great Plains has a environmental toxins and heavy metal toxicity panel that I can run. So that kind of tells me what kind of heavy metals, if it's mercury, if it's aluminum. A lot of kids have aluminum toxicity, heavy metal toxicity. So that kind of narrows it down to, what we're dealing with.
Okay, so you had silver fillings, right?
Yeah,
I've heard that.
Fillings.
And they're actually mercury?
Yeah, they're mostly mercury. So they're very, you kind of expose
deceiving.
Yeah, they call them silver, but it's actually mercury.
Yeah, because I think I've heard other people, I didn't realize that they call them silver because I don't have them. But I've heard other people be like, oh no, I'm okay because I have silver.
No, yeah. They're mercury amalgam fillings. They were kind of standard practice for millennials. That's kind of what we received before they switched it over to what they use now. But, I think I had like 4 from childhood that had just been in my mouth. So once I heard about all the toxic, I'm exposing myself to low levels of mercury, I was very eager to get them taken out. But when you get them taken out, if you don't have them taken out using the correct protocol by a biological or functional dentist, then, you're exposing yourself and the dentist and the hygienist to, significant levels of mercury. So I was not aware of that at the time. So that's something I always like to, they don't do that anymore, but for people who do, so kids don't usually have to worry about things like that because they don't usually use that anymore.
Right.
But adults, a lot of adults, we still have those from childhood.
Wow. So how do you treat heavy metal toxicity? Now that's like a loaded question, and we've just gone over how, you really want to treat everyone like bio individual. But what are some of the different ways that you treat?
Well, first, like just going through the foundations, healing gut issues that they have, if they have things like leaky gut syndrome, which I find most people do,
right.
Healing that gut lining is really essential. Just getting them in better health before we address usually like month like that, where we start addressing that. But I use binders. Binders are really important. Cellcore has a great binder. I think it's the HMET, I think that's called, for heavy metal toxicity. But before that binder, I'm going to use other binders, like biotoxin. I'm going to use Varadcam binder. So binders are really, really essential. Dr. Jess, I'm sure you know who she is, but she kind of coined the term kill, bind, sweat, killing whatever it is that you're trying to kill in your body and then binding it with a binder, because otherwise it's just you kind of awakened the heavy metals and got them circulating in the body, and the binder kind of removes them.
Can you explain? So it like binds?
Yeah, it kind of soaks
like
them up and pushes it out through like phase 2 of the, liver detoxification. It's kind of how it gets out of the body, and it can get out through sweat. It can get out through, urine, poop. things like that. So it really kind of depends, on, the child and the adult, what kind of heavy metals they have, what's appropriate for them as to how we're going to remove it. For a lot of adults, I really love an infrared sauna. That's not going to be as appropriate for a child, especially a small child. I work with kids as young as 2 years old.
Right.
Heavy metal toxicity. So I'm not going to put a 2-year-old in a full spectrum infrared sauna, but for adults, I really like infrared saunas. Also making sure the liver is functioning really, really well, because the liver bears the brunt of dealing with heavy metals, making sure they're methylating properly, because that's all a part of the heavy metal process.
Right.
And a lot of kids with autism in particular are not methylating properly. More and more people have MTHFR gene mutations. So all those things that are very bio-individual, how we treat it. I've never really given the same protocol to 2 different people. So
that's
very
good.
individual. Yeah.
Yeah, that makes sense to me, I think.
Mm-hmm. But if mom can do that before pregnancy, ideally, I know that's not always the case, but if she can, that's going to significantly lower that burden for that child.
Right. What advice would you give to parents out there listening who are concerned their young child might be struggling with age-appropriate communication, and where do they start?
Well, depending on the age, when I worked in schools, obviously I've worked with a lot of speech and language pathologists. So speech and language pathologists are a wealth of information, and the earlier, you start working with them, the better.
Mm-hmm.
Particularly if you can work with them one-on-one. In the schools, depending on, if a child is even in school age or not, in schools, they kind of, schools provide the bare minimum of service. So, and it's usually in a group setting. So if parents can, at the first signs, work with a speech and language pathologist one-on-one, I think they will improve exponentially. But at the same time, those services don't necessarily treat the root cause. So I'd also be looking at things like gut health. Gut health is really intertwined with communication and language. I work with a lot of kids who, when we start addressing root causes that they have, their language just improves exponentially.
Wow.
So, when you treat the underlying cause, when you correct those imbalances, communication and language really improve.
Wow. So what are your top 3 for the foundation? You keep saying the foundation. So for children, what's the foundation? Top 3.
I mean, like making sure that they have a good foundation, or things that I focus on when I'm working with the child first?
When you say working on their foundation.
Looking at, if they have significant micronutrient deficiencies, which most people do. Looking at that, looking at leaky gut is something I like to look at first. Really gut health as a whole is the foundations. If they need immune support, supporting their immune system, but also figuring out why their immune system is suppressed in the first place. So those are the top things, as far as if you want to make sure your child has like optimal foundations from birth, reducing the risk of C-section, the cascade of interventions, breastfeeding. There's significant research on breastfeeding and how kids that are not breastfed, like myself, have significantly higher incidence of chronic illness. Those would be, my first go-tos, making sure their foundations are just really optimal. Making sure, when they start eating solids, that it's high quality micronutrient dense food. All of that is really going to make sure a child's foundations are optimal, as well as, mom healing any gut issues if she can before conceiving, are all going to make sure baby has the best possible foundation.
Where can people find out more about you and your work?
Well, on Instagram, I'm Dr. Mara Bargeron on Instagram. I have a website, which is the same name, drmarabargeron.com, but it's my web designer's doing her magic. So that's not really up and running yet. So it's being completely revamped. So it should be done in a few months. We're still in like beginning phases. So for right now, Dr. Mara Bargeron on Instagram, they can contact me on there.
And you work with people virtually from all over?
Virtually, yeah, all over US and Canada, but no one outside of the US or Canada because I can't run labs or anything like that for people.
Right.
So, but yeah.
Awesome. Is there anything else that you would like to share with the Brain Possible community today to be complete?
I think one of the things I think we were going to discuss was, the higher incidence we have of kids nowadays that have things like asthma and allergies. There's a lot of risk factors to that. And we kind of went over some of them, C-section birth is one, lack of breastfeeding, hand sanitizers.
Oh my gosh. Yeah.
I know that kind of goes back to the microbiome. We have trillions of microbes, which are bacteria, viruses, fungi, and our health really depends on our microbes being in a healthy balance. So there's some opportunistic and then there's a lot of healthy. So contrary to popular belief where everyone wants to demonize all germs and all microbes as being bad, especially in today's society, we really depend on those. So when you use things like hand sanitizer,
right,
a lot of them have been recalled. Like there's a lot of evidence, the key ingredient in hand sanitizer. I think the Environmental Health Perspective Journal, they did a research study and found it's associated with seasonal allergies in children under 18. So you're really kind of moving all the healthy and unhealthy on the skin, which is not ideal. So I always just recommend, I use, I think it's called Alivia. Have you heard of that company, the Alivia brand soap?
Oh yeah, so it's not really soap, right?
Yeah, it supports the microbiome, but they have a hand soap now. So that's what I use for myself and for my son. We use that, so we're not like killing all the good guys on our skin because they're not, it's not all bad. You don't want to sanitize, and schools nowadays are just like over sanitizing everything
everywhere.
They have protocols now where you walk into the classroom and you have to, use hand sanitizer.
Yeah, I know.
Where you walk into the classroom, they were spraying down like carts with toxic cleaning products at grocery stores, and kids were getting these rashes on their legs because they were sitting in the cart.
Oh.
So it's just, we're just over sanitizing, and it causes like these super bugs, which is kind of what glyphosate does for food. The pesticides, it causes super bugs. So it makes, the bacteria resistant and, to killing it. It's more difficult to eradicate the bacteria then. So that's what these hand sanitizers and things like glyphosate cause in crops. So it's something I always ask parents to avoid, but there's just not enough knowledge on that. And the message that you always hear, especially on the news or from any health professional, it's like, use your hand sanitizer.
Oh yeah. No, it's better to wash your hands, right?
Yeah.
If you're going, yeah.
Yeah, I've never used, I think I'm the only parent at the park that doesn't use hand sanitizer on my child. Like I've never used hand sanitizer on him. It's just, kids need to also play in dirt. Like it's good microbes. I understand like when you're touching a cart or something like that, where you don't know what's on it, but kids need to be exposed to germs and microbes.
Right.
Immune system to develop appropriately.
What would you do in an airport if your child was, like touching everything in under the seat and all of it?
So Airplanes tend to be really disgusting. They actually, prior to this whole COVID thing, they never actually cleaned. Like very rarely did they ever clean, anything in.
They are disgusting. I
Yeah.
know because I have a lot of kids, and sometimes they even have accidents. Maybe they've thrown up or peed on the floor. And if I've seen my kids do that, lots
Yeah.
of other people have too. And
Yeah.
they don't clean that.
There are non-toxic options out there. I can't remember like the name of the wipes. Sometimes I make my own. I have like my own little liquid. I have like tea tree oil, things like that I use. But there are non-toxic options out there that you can use for things like when it's really necessary to disinfect something, like
Yeah.
vomit and stuff like that. You're definitely going to want to disinfect. Vinegar goes a long way
Yeah.
at disinfecting naturally. It's a much better alternative than bleach. So there's a lot of non-toxic options out there that you can use in those emergency situations.
Have you seen that? It's like a water bottle that you can put soap in.
Oh yeah, I forgot what that was called.
I don't
It's
have it, but it looks interesting.
like that. Yeah, I've seen that in a couple people's stories. I kind of screenshot it in case I need to buy it one day, but it's really good for, if you're going camping or, hiking or things like that where you might need it.
To wash your hands.
Mm-hmm. Yeah.
Well, thank you for bringing that up. I completely forgot that was the original topic that I contacted you about. I'm sorry.
Oh, no, that's fine. We'll have to talk about that another day.
Yeah. Well, yeah, no, allergies. I interviewed an allergist, and we were discussing why, eczema, if she could not say why, but why eczema the rates have gone up so high, and allergies just in general, and then some really bad allergies, severe allergies. I have on both sides of my husband's family and my sister, there's kiddos who have really severe, like they'll end up in the ICU if they get exposed to certain things. And why?
That it's going back to the microbiome, people don't have as diverse or as healthy of microbiomes as they once did. Allergies and asthma are a new thing. It was not a problem for our great grandmas. No one had allergies or asthma, so this is a very new thing that's been brought upon by several different reasons. But one is the microbiome. Another, the research studies I talked about with the C-sections and, breastfeeding, that also is going to cause more incidence of allergies and asthma and eczema. The use of hand sanitizers, the use of toxic personal care products and toxic cleaning products. A lot of that causes allergies, things that have fragrance in it. A lot of these products have endocrine disruptors like phthalates, and that is all going to cause asthma, allergies, eczema. There was also a study by Hooker and Miller, one of my favorite studies. I think I have it linked in the link in my bio because it's like such a big study. But the CDC always refuses to conduct research studies on vaccinated versus unvaccinated children. But so we had an independent third party actually did do that, a big research study on the two, Hooker and Miller. And I think they just released that in 2020 or 2021. But they found that children who were vaccinated and not breastfed or vaccinated and delivered via C-section had the highest rates of adverse health outcomes. So that includes neurodevelopmental disorders, asthma, eczema, just chronic illness in general. So the kids that were worst off were the vaccinated and not breastfed and vaccinated and delivered via C-section. They had the highest rates of adverse health outcomes, and other studies that have shown the difference between the two. And the vaccinated children have more incidence of eczema and allergies and ADHD, autism. So that's also more research that people are not aware of. that's out there, because it's definitely not going to be,
No,
or anything like that.
no, yeah, I understand. Well, thank you for sharing and making your page available for people to just, people from all walks of life to learn about root cause. And I know it can sometimes probably be a little hard because people want to then get advice from you without actually working with you. But it makes a difference because they're learning and they become aware.
Yeah, that's really my goal, is to just give people the information and give them the informed consent. And you could make whatever decision you want, as long as you have the informed consent. But what we're really lacking in healthcare is informed consent. That's not something that parents are given, or adults are. When I work with kids or adults, they're usually very frustrated by the time they meet with me, because they've just been really screwed over. Their children have been really impacted by conventional medicine, pediatricians, just a number of different healthcare professionals. So they're very frustrated and worn down, and they were never really given informed consent. So that's really my overarching goal, is just to provide that to parents so they can make the best decision that they can for their time.
Yeah, I understand. It is frustrating. And what you mean by informed consent is, letting people know of all options and risk factors ahead of time before anything, right?
Yeah, the implications, the consequences, or the risks to whatever it is, whether it's a procedure or whatever, a prescription, whatever it is, just letting them know what the risks are, because that's something that isn't done. They talk about the benefits of it. Healthcare providers talk about the benefits of a pharmaceutical or whatever it is, a procedure, but they don't talk about the risks associated with that, or any alternatives, because they're not trained and really know.
Right. And they might not even know.
They don't know
the full slew of risks.
And to them, they don't think there are any other alternatives. So it's just kind of how they are.
Yeah.
In medical school, they want to see things from that one way to do things. So that's really what I provide to parents, is just true informed consent, so they can make better decisions.
Well, thank you for that. I appreciate your time today. I know that your time is valuable, and thank you for spending it with me here at the Brain Possible.
Thank you.
I hope that you enjoyed our conversation today and that you learned something new. Do you have a question for Dr. Mara? Do you have your own story you'd like to share with us? We would love to hear from you. Let us know how we can be useful in your journey. Email us at info@thebrainpossible.com. Be sure to subscribe, follow, and share our podcast if that feels true for you. You may also consider visiting our website for more information on stories, therapies, and products that we think that you will love. As always, thank you for spending your precious time with us at The Brain Possible. See you next week, and be well.